Okay, are you ready? I'm ready to talk about our safety system in perinatal care. So, good morning, everyone. My name is Shin Ushiro. I'm from my country, Japan. I work in Kyushu University Medical Center as a deputy director in charge of patient safety, as well as JQ. JQ is an organization that provides hospital accreditation in my country. I'm a board member of JQ in charge of hospital accreditation and no fault scheme for cerebral palsy that I'm going to talk about in this talk, and national reporting and learning system covering hospital, clinic, community pharmacy, and dental clinic as well. And on this occasion, on this valued occasion, I'm really honored and privileged to be a lecturer in this valued session, valued conference. Thank you very much for having me. And in order to introduce myself, I'd like to move on to the next slide, but please take a look at my photo in the next slide. Look at that. I turned my photo into the Ghibli image. I did it through AI, artificial intelligence. We all agree with that AI and the digitalization is spreading in healthcare industry as well as other industry. In my hospital, AI is still working. Still, AI has already arrived and it's working very effectively, not only for clinical work, but also for administrative work to lessen the burden of physicians and other clinical professionals for all the administrative work. But putting the topics on AI and the digitalization aside, I'd like to focus on compensation system, no fault scheme for cerebral palsy this morning. And in 2009, we introduced a novel system, which is called the no fault compensation system to perinatal care because our country, Japan, suffered a significant shortage of obstetricians due to long working hours and burnout and the rising lawsuit and conflict. So the study committee was established in leading political party. It stated in a framework document that it's normally difficult to figure out whether the physician's procedure, midwife's procedure is negligent or not. But those cases often goes to the court. So that's one of the reasons of the shortage of obstetricians and midwives. So the leading political party launched a framework that compensates a patient, which is cerebral palsy, and as swiftly and in order to bring conflict into settlement as fast as possible. And the last but not the least, the new framework establishes a mechanism that improves quality and safety in perinatal care. And as I told you, JQ and I am in charge of running hospital accreditation, national reporting and learning system. All those initiatives are closely linked to patient safety and quality improvement. So the leading political party, Ministry of Health, and other stakeholders came to JQ to ask us for launching the new novel system, no fault compensation system, along with the leading parties framework. And we successfully launched the new system in 2009. Our no fault compensation system provides monetary compensation as well as investigation and prevention services. And as now I am repeating no fault. What it means? No fault compensation means that we compensate, we provide monetary compensation to patient and family, regardless of whether the procedure is negligent or not. And so we swiftly provide monetary compensation to patient and family in a difficult period. And then after that, we published investigative report in close cooperation with academic society and experts. And then with those reports, we have already published the 4,000 report. With those reports, we carry out learning and the prevention services across my country. And here you see the registration rate, nearly 100%. This is not a mandatory system because the government didn't have time to launch a legislation for this system. However, in close cooperation with professional bodies, academic bodies, we successfully achieved nearly 100%. Only one clinic is out of this system. However, nearly 100% was achieved. And this system is run by 5 committees, like steering committee, review committee, etc., etc. And please note that we, JQ, works with patient and families. And only technical committee do not have family or patient representatives. However, other committees include patient and family representatives. One of the committee member is a person who lost his baby during childbirth, probably due to the excess amount of oxytocin administration. And here you see the financing mechanisms of the compensation. We work together with private insurance companies, and the insurance premium is paid by childbirth facility to the insurance firms through JQ. So now you understand that financial burden is imposed on the childbirth facility, like your organization, like your institution and my institution. However, it's not true. The childbirth fee, the delivery fee is raised to pay insurance premiums. So the mothers and fathers pay more to medical institutions. However, it's not the mother and the father who bears the financial burden. When baby is born, our public insurers pays money to celebrate the childbirth. So the government instructed the insurers to raise the money for insurance premiums. And the insurance money comes from all the employees and the employers in my country. So, in effect, the financial burden is imposed on employers, employees like me. I'm an employee of Kyushu University Medical Center. So we bear the burden. That's the mechanisms. And here you see the amount of monetary compensation. We pay money in 2 different ways: one-time cash, the lump sum payment, a lump sum payment that is followed by annual installment for 20 years. After 20 years, the government pays pension to disabled people like cerebral palsy. And here you see the eligibility criteria. We compensate only profound cerebral palsy, and we exclude cerebral palsies caused by congenital factors like genetic abnormality, chromosomal abnormality, and as well as cerebral palsy caused by neonatal factor like meningitis or injury, etc., etc. But if we only exclude cerebral palsy, if the cause of genetic factor, chromosomal factor, meningitis is apparent, obvious, otherwise we compensate. And here you see the statistics of the eligible case. We began with 419 in the first year. In the next year, 382, followed by 355, etc., etc. So we successfully observed the decrease in the number of eligible cases. In other words, we successfully observed the reduction of harm significantly, particularly in the first 5 years. And as I said, we produce investigative report. We have the committee for producing investigative report, and we also have 7 subcommittees to produce draft report. And then we collect all the data like medical chart or CTG monitoring record, etc., etc. And what is important is that we hear voices from parents. And then with those data and the voices, we produce draft report to be endorsed by parental committee. And what is important is that our investigative report is shared not only with childbirth facilities, but also with parents. So parents will get the same investigative report and they will read it and they will know what was the quality of the delivery they went through in childbirth facilities. And here you see the table of contents in investigative report. And we produce standardized report. So the table of contents is exactly the same for all the 4,000 report. And this is a wording list. As I said, we are sticking to the production of a standardized report. So when we assess individual procedures like interpretation of fetal heart rate monitoring, or when we assess the procedure of physician or midwives during the delivery, we use the same word from the wording list to produce a standardized report. And what is important to choose words from the list is that we produce a standardized report, and the standardized report is comparable each other. So we can conduct a comparison study of 1 year and another year. That is very good. Here, and we also produce a synthesis, the summary of the report, and those reports are available on the website. You can have an access to our report on the website. In other words, we provide massive text data available on our website. Probably in the near future, we will apply artificial intelligence to analyze our massive text data on our website. And we conducted investigative report satisfaction survey a couple of times. Here you see the result, the outcome of the survey. The red part is corresponding to the population in favor of our investigation report. And the guardians and the childbirth facilities, all those populations are increasingly in favor of our investigative report. And some guardians do not like our report because the cause of cerebral palsy was not identified. However, it's a limitation of our medical science. We know that nearly 40% of cerebral palsy has unknown origin, unknown cause and unknown origin. Probably they are caused by genetic abnormalities that have been unknown. And you may want to ask me about what happens if the profound cerebral happens again and again and again in a single clinic or single facility due to the same procedure. If it happens, we send letters, warning letters to the institutions, and we ask those institutions to report back to JQ improvement plan within 6 months. And if they like site visit, we provide educational site visit services to the institutions. We have already made 5 or 6 site visits to medical institutions for education. This services was initiated 3 years ago after the COVID-19 pandemic. And this is really effective. But this services is carried out under the condition of anonymity. We do not disclose the name of the institution, name of the medical professionals involved in the profound cerebral palsy cases, because no blame culture is quite important. But we report back to steering committee of this system so that committee member will know what type of error happened and what kind of education was provided to the institution and staff. And with more than 4,000 individual investigative report, we publish prevention report on annual basis. We put all the cases we put all the cases on collective analysis to produce quantitative and qualitative data. And then the prevention report provides data for clinical guidelines, and the prevention report is circulated and shared among medical professionals like you and others, and even government. And here you see the table of contents of annual prevention report. It includes qualitative analysis and quantitative analysis. And here you see the themes of thematic analysis. Maybe you are very much familiar with all the themes. It's closely related to the obstetric care. And as I said, our prevention report provides data for producing or updating clinical guidelines related to childbirth. And another product from our system is the brochure or a booklet for prevention. And we produce it not only for medical professionals, but also for patient and family, particularly pregnant women. And come to think of the comparison study of 1 year with another year, we are really happy to say that some procedure is improving, such as the fetal heart rate monitoring, and excess administration of oxytocin is getting less frequent, and mechanical ventilation within 1 minute after birth is more frequent. So here you see that trajectory of lawsuit, conflict and the lawsuit related to obstetrics and gynecology. The system was launched in 2009. And 2 years back, 2007 and 2008, I traveled across my country to describe the new system. And the number of lawsuits related to obstetrics and gynecology dramatically and quickly dropped to the level that is comparable to other clinical specialties. And here you see the description of a report published by the Supreme Court of Japan. The Supreme Court of Japan praised our system because we achieved the rapid decline in the number of lawsuits. And the Supreme Court of Japan is expecting to expand the system covering other clinical specialty, but it is really, really costly. So we have not done it yet. So another country that suffers the similar problem is UK, particularly England. Here you see the newspaper article that says the total liability cost is skyrocketing, damage payment is skyrocketing. And so I was invited by UK Parliament, and I joined as a witness in a House of Commons special committee. It was chaired by Mr. Jeremy Hunt, who used to be the health minister and foreign minister and the finance minister. And I described my system together with the other international experts from Sweden and New Zealand and the United States, Virginia state of the United States. And the Imperial College London that I have been working with published a global report on patient safety in 2023, and they included 9 outstanding initiatives in the world on patient safety, and our no-fault compensation system is included among the 9. Others are from 5 from UK, 2 from US, and 1 from New Zealand. And our system is the only one Asian initiatives in the report. And so this year I was invited by RCOG, College of Obstetrics and Gynecology, which took place in London, and I described our no-fault compensation system. I'm sorry. And the last but not the least, this year, Ministers' Summit on Patient Safety took place in Manila, Philippines, and I chaired a session related to AI and healthcare. And as I said, we provide massive text data, so maybe AI will work with our text data. So in a chair's speech, I described our no-fault compensation system in 7th Ministerial Summit on Patient Safety, which took place in Manila, Philippines this year. So that's I think, yes, this is a synthesis of my talk. So that's all I have brought to you on this very valid occasion. So thank you very much for listening. I'm happy to take questions later on. Thank you very much. Thank you.